if you're going to be coming down with such a hard rule that people are having a hard time with, open to test for natural immunity. I mean, that's what we do for chicken pox, right? You do your blood work and you prove that you have natural immunity, or you get immunized, right? And healthcare workers don't have a problem with that, right? We have lots of vaccines. It was just, to be forced into taking something that was still in clinical trials is troubling ethically.
For Rebel News, I'm Tamara Ugolini here in the Greater Toronto area, and I'm joined today with Scarlett Martyn, who is a paramedic and also one of the founders of the United Healthcare Workers of Ontario, who really took a stance during the COVID hysteria and especially the mandates, advocating for the informed consent of not only people as a whole, but healthcare workers in particular. Is there anything there that I should add to the United Healthcare Workers of Ontario's mandate that I missed, or is that kind of a good broad overview?
No, that's great. We are just passionate about informed consent. It's the very tenet of all medical ethics, and I think during the pandemic it kind of got forgotten about, and it led to bad outcomes. We heard lots of things about COVID, but not a lot of things about the collateral damage it was doing. So those of us that didn't agree with everything imposed were trying to band together and effect some change.
Now, just recently, you have filed, or your group has filed, a class action lawsuit naming the King in his right of Ontario, and specifically the Medical Officer of Health of Ontario, Dr. Kieran Moore. I note in the statement of claim that there is specifics around a statute of limitations that prevented certain members of the United Healthcare Workers of Ontario taking part in this class action. Can you tell us a little bit about the mechanisms at play to try to bring this suit forward?
Yeah, absolutely. We're super excited about it. We think it'll be impactful. The named defendant is Dr. Kieran Moore. It took a while to get organized, and we're always told you're unionized. You have to just go to your union. Most of us didn't feel supported by our unions, and it's a whole different avenue then to go try to get answers from the union. So, the clock was ticking, the statute of limitations. Generally, there's some exceptions, it's 2 years. So it took us quite a while to get organized. And find a lawyer that had some other insights that we could approach for this. And when that was going on, specific to Ontario, there's a rule that if you're going to file a claim, you have to give the Attorney General, it's 6 or 8 weeks notice of just the filing. You can't just file a claim like every other province. So during that time, there was 8 of us initially as named plaintiffs, and I was one of them. And during that window, we were kind of cutting under the wire. Our statutes ran out. So we found one very brave healthcare worker that was terminated late in the game, and she stepped forward. So our class action lawsuit has one named plaintiff, Lisa Wolfs, and she's an incredible, strong person, very brave to do that. Because the class action lawsuit everything will fall under her statute. So any member, like any healthcare worker in Ontario, even if their statutes run out, because she's the representative plaintiff, we all fall under her umbrella. Mm-hmm. So yeah, we're super fortunate for her. The downside to that is, with a class action lawsuit, it's a way to bring a legal case that represents hundreds and hundreds of people without hundreds and hundreds having to go to court and have separate trials. But only in Ontario again, specific to Ontario, as it approaches certification from the court, if the certification doesn't go well, there's a possibility that the named plaintiff can be held personally liable for the court costs and tariffs and stuff like that. So she's really sticking her neck out on the line. She doesn't have any more to gain from this than we do. We're all just kind of equal in that. So we're trying to raise funding to bring this to litigation to get it certified and be impactful. Totaling, I think it's $170 million of damages, which I think will be an impactful number. There's a lot of healthcare workers in Ontario, though. So you don't really join a class action lawsuit. You just, if you fit the definition of the class, then you are a member of the class, right? You don't actually have to contribute to a class action lawsuit to be part of it. Like an example, I think anybody on Facebook kind of could named under their privacy breach, right? And I guess when they settled, it maybe was like $25 or $50 each, right, that they got. So similarly, we don't know how many workers will come forward and how many will be able to hear about this if we do have a successful ruling. It will be years in the making, but our first step is to get to certification.
Mm-hmm. And the misfeasance in office on Dr. Kieran Moore, which I've personally reported on his conflicts of interest as a board member of Pfizer.
I have an honoraria from the Ontario College, and I'm on the advisory board of Pfizer for their Lyme disease North American strategy.
To then be in a position like his, where he was putting out Directive 6, which is the base, a big part of this claim, where stipulating mandates for a product from Pfizer, which he has clearly declared previously as a conflict of interest. In the misfeasance in office, what does that mean and where does that stem from?
So the class action has 3 separate parts. And it's really amazing because they all stand independently. So one of those is the Chief Medical Officer of Health misfeasance in public office. So that's, in a nutshell, that's him using his statutory authority to implement Directive 6 and just, speaking completely contrary at the time to the available evidence, right? Like there was no available evidence about stopping transmission, right? Or spread. Therefore, we're keeping a workplace safe by how, right? So, in a nutshell, the misfeasance in public office is just stating contrary evidence to what was available at that time. I'm going to say probably most in healthcare had already been exposed. So if you're going to be coming down with such a hard rule that people are having a hard time with, open to test for natural immunity. I mean, that's what we do for chickenpox, right? You do your blood work and you prove that you have natural immunity or you get immunized, right? And healthcare workers don't have a problem with that, right? We have lots of vaccines. It was just, to be forced into taking something that was still in clinical trials is troubling ethically.
Mm-hmm, mm-hmm. What are some of these stories of the healthcare workers and the damages that they still suffer as a result of this mandate? So many people say, oh, COVID's over, forget about it, just move on. But that's not so easy when your whole life and your livelihood has been swept from under your feet.
Yeah. We have about 3,500 members just in Ontario that were healthcare workers. So it's multidiscipline, right? We have research scientists, physicians, paramedics, nurses. But the impacts have been horrendous. I mean, people have lost their jobs, they've lost their livelihoods. Anybody that has their own regulatory college, if they're dismissed or terminated for misconduct, they can be held, their regulatory college can pull their license. So I know a lot of nurses were really nervous. Like some of them just quit, took early retirement. But there was a few that thought, no, this is wrong. We have to see it through. Their risks were great, but personal hardship, I mean, just, without a job, loss of homes. I know for us, we were terminated right around Christmas time, right? It's a horrible time of year to take somebody's livelihood away.
Mm-hmm. And for many of these individuals, there's never been an opportunity to recuperate or recover, though that loss in income or that loss in seniority, even in many instances. So this is hoping to cover at least a portion of that, but I suppose also at the same time set a strong precedent for perhaps future pandemic responses.
Yeah, that's exactly it. Who knows what the ruling will be in the end, but a benefit to bringing something to trial is there's a record of it then, for the public to see. I don't think we can accept we were just doing the best we can and those kinds of excuses, years into the pandemic and the damages that they were causing. And continue to cause. Ontario has many sectors of healthcare that are not back at work. They were very public about implementing these mandates, and now it's all done by internal email. So we get internal emails sent saying, oh, this hospital's dropped, that hospital's dropped, and there's really nothing public. So yeah, it's still, and this was at a time that we were already in a healthcare crisis for staff. I mean, things were so bad, and now we have the mixing of paramedics who are unvaccinated working. That we do our field calls and we bring patients into the hospital, but we're working in the hospitals on offload delay, waiting to offload patients, and we care for them in the same hospitals that our nursing colleagues can't come back to work yet. It's impacting patients, right? And people don't know because, like you say, people think, oh, we're over and done with the pandemic. In many ways, we're not. And I think a lot of healthcare workers that stood up for this because it was wrong and unethical, to try to counter the argument about us being, anti-vaxxers and we don't care about people. We certainly do, right? Like we worked during a pandemic, we worked overtime, we joined, special teams and went over and above. I mean, it's two different things. If it was anything about patient safety, we can wear PPE or test for natural immunity. But you really felt like your arguments fell on deaf ears.
Mm-hmm. Yeah, and you were disposable at the end of the day, and really you were. And that lasted not just a couple days or a couple weeks. This was years ongoing.
Yeah, and we would like to see this through. Like, we would like to bring it about. And it's interesting because it's an avenue for unionized healthcare workers to be part of a lawsuit, because we're not suing the union and we're not suing our employers because we can't. There's no avenue to do that. That has to be done through a union. But because we're naming the chief medical officer of health as the defendant, it's different. So part of it is that, the union and the employer have a contract together, and in a unionized environment, that contract's collectively bargained. So it's a big deal, right? So the chief medical officer of health can't really insert himself into that contract and change the terms of our employment.
And which he clearly did with Directive 6. Now, for anybody who doesn't know about United Healthcare Workers of Ontario, who wants to know more or who wants to help with the costs associated with this filing, where can they go?
If they go to our website, it's UHCWO.ca, so it stands for United Healthcare Workers of Ontario. There's information up there about the lawsuits. We're just working on a spreadsheet, actually, trying to post currently across Ontario which hospitals and facilities have lifted mandates and which haven't.
Well, thanks, Scarlett. And if you're someone who feels like they're alone in this madness, especially healthcare workers or healthcare professionals, you can find Scarlett at United Healthcare Workers of Ontario. For Rebel News in the GTA, I'm Tamara Ugolini. To find out how you can take some action and demand the revocation of these shots from the market, you can do so at nomoreshots.ca. At that website, we have a petition, and we also have a form email that you can send to our Federal Minister of Health, Mark Holland, calling on him to revoke market authorization of these injections. That's nomoreshots.ca.